introduce themselves as well. We have first Latasha Atkins Lee, and we also have Eleanor Elle Johnson. Thank you all so much for joining me today. I appreciate it. Before we get going, I will let each of you introduce yourselves. Tell me about how long you've been in nursing, kind of a little bit about your career, and then we'll kind of launch into the discussion from there. Elle, you can go ahead and get started.
So my name is Elle Johnson. I have been a nurse 12 and a half years now. Have worked the vast majority of my career in hospital medicine and critical care, and am transitioning from a career in resuscitation medicine and into being a family practice nurse practitioner. I have worked for the last about 3/4 of a year in a Somali clinic in Minneapolis, and am transitioning from that role as well. So.
Wonderful. And Latasha, tell me a little bit about your career as well.
Okay, my name is Latasha Lee. I have been in the nursing field for 27 years. I started my nursing career as a certified nursing assistant. I was a CNA for 9 years, and then I realized I wanted to explore and go on further. So it was at that time that I completed my BSN. And so now currently I've been a nurse for 14 years. And I've done so many different types of nursing. I've been a medical surgical nurse. I've done neuro nursing. I was an orthopedic nurse. I did some residential care with young boys ages 8 to 18 that were in abusive homes. I've also, since I've been in the Twin Cities for the last 5 years, I've had an opportunity to work with ladies that have issues with substance abuse. And I've done that at Wayside Recovery Center. I was a school nurse. And currently I'm a pediatric nurse at Children's Minneapolis. And before I was at Children's, I worked at Gillette for some time. And I also, the last 2 years, I taught master's students at Metropolitan State University. I taught the Leadership 690 course. And currently I'm on the Minnesota Board of Nursing. I was appointed by the governor this past September 28th. I'm in a 4-year appointed seat. I also serve on the NAACP Behavior and Wellness Committee. And last and not least, I also do a little bit of work with Northside Fresh, which is a coalition that focuses on food injustices for residents on the north side of Minneapolis. And my biggest of all-time favorites is I am most recently a new owner of a certified nursing assistant school, and the grand opening was in January, and we're thriving and we're doing absolutely amazing. So those are all of my offerings to the nursing sector.
Good for you, Latasha.
Thank you. Well, thank both of you for all of your contributions during what's been a really challenging, stressful, unprecedented year for your field. But you are surviving and still thriving and still smiling. I see.
This is true.
All of it. And so it was actually this topic of conversation. It came about. I had a chance to do a story with Latasha about her certified nursing assistant school. You'll probably see the name kind of tick across there at the bottom, along with Elle, and a little bit more about her work with Sama Healthcare. But I thought about it because she told me a piece of the program entailed the cultural awareness component. And I had never really thought about that. And I said, well, that might be something that's kind of interesting to talk about. And I started thinking about the nurses that I know in my life. And you two rose to the top. I was just meeting with Latasha, and then I've known Elle now for several months. And what better group or of women to have this conversation with than you two? I know you offer the cultural component in your coursework at the CNA school, Latasha. And then Elle, your background, you speak Spanish, but then you also are working at a Somali-American clinic in Northeast Minneapolis. And so culture seems to be a big piece of what your job entails. Can you tell me kind of over the years, looking about maybe where you started in your career to where you are now, how do you feel that the cultural component of what you do has evolved?
Are you for me or Latasha?
For Elle.
Oh, okay. Yeah. So, boy, I grew up on the East Coast. I grew up in New York, and the one of the differences between New York and Minneapolis, one of the big differences is, I guess from my perspective is that New York seems to be a little bit less integrated in terms of culture than Minneapolis does. It seems like from my observation that there seems to be a lot more integration of culture, which is such a great thing, I think, about Minneapolis in particular. But it does present challenges for both the healthcare provider and the healthcare recipient. And kind of as the years have progressed, I've seen sort of a transition from working on the East Coast with much more Spanish-speaking population to working here where there's a lot more Somali-Americans, Hmong Americans, and it's sort of not losing my footing a little bit with regard to understanding the language has been a really humbling experience. Working at this clinic over in Nicollet, I've gotten to really interact quite a bit with the Somali-American population, and it's such a rich culture that I have enjoyed working with so tremendously. So it's been really an honor to be a part of it all.
And so really you have to kind of remain open to adapting, because as the country becomes more and more diverse, so do the patients that are coming in the doors. Would you say, Latasha?
Well, absolutely. So in my line of work at Children's, first of all, let me just say, one of the things that I appreciated most about Minnesota when I originally came here 5 years ago on a travel assignment was all of the different cultures and diversity. I actually appreciated it because it was limited where I came from. And so working at Children's Minneapolis, I have the opportunity to meet all types of people. And the Somali population is really big in our hospitals, but so are like the Hmong. There's a lot of Chinese, there's of course white, there's Black. And I'm sure there's a couple that I'm forgetting, but I like it. But I also realized and recognized early on in my career here in Minnesota that there were tremendous cultural language barriers. And so some of the hospitals where I work at, because I've done North Memorial, Maple Grove, Methodist, Children's, Gillette, just to name a few, some of the facilities are really intentional about having that interpreter at bedside. And then there's some where it's not as readily available. And so, quick observation for me, I realized that a lot of times in order for the providers to make the best possible diagnoses, they need to get the best history from the patient, right? So if there's language barriers, there are several things that come into play that will kind of like not allow the doctor or provider to make the correct differential diagnoses. And that's just the information that's given so that the doctor knows best like what's going on with the client. But oftentimes, I notice that some of the adult hospitals, there's not interpreters all the time. And I realized that these are things that we need to advocate for. And I did do some work for that. Because I just felt like, especially being a Black woman, we also have barriers in general in the healthcare sector. So that's always something that's been near and dear to my heart. So I'm always advocating for every patient that I come across to get the best healthcare that they can. So I was one of the ones that was advocating for that because I felt like some of the needs of the patients weren't being met, not just from the provider, but also from the bedside nurses. Because if we can't really understand them and there's no family there, then what kind of service are we really providing? And so it's a really big thing, and I'm glad that we have the opportunity to talk about it today and shed light. And I will say, since I started 5 years ago and where I am now, I believe that it's a lot better. There's not many times at Children's where there's no interpreter. There's always interpreters for our patients. Whether it's the phone, the Marty, in person, there's always options.
And if you're just joining us, we're talking about nursing across cultures today. As the country becomes increasingly diverse, so do the patients that nurses are seeing at bedside. And so over the years, so do the needs of the patients, mm-hmm. They change. And we're talking to a couple of nurses here in the Twin Cities area about what they're kind of seeing on the job and how they've seen the demands and the needs change and evolve over time as the patients grow more and more diverse as well. Elle, I saw you kind of shaking your head on some of the things that Latasha was saying. What kind of resonated with you there?
Latasha, you hit the nail on the head with everything. I think that also another thing with regard to interpreters specifically is that healthcare providers don't necessarily know exactly how to interact with an interpreter when an interpreter is at the bedside. So one of the things that was recommended to me many years ago with interpreters is to triangulate yourself. So when you're speaking to a patient using an interpreter, to speak directly to the patient and to talk to the patient and have a conversation directly with the patient. And what I see, one of the pitfalls I see often with interpreters is, healthcare provider, nurse, doctor, whoever will go into the room and talk directly to the interpreter and say, can you tell her that I think that she needs to cut back on her blood pressure medication? And it just takes sort of the humanity out of the interaction. But it also it's not a relay system. You're the healthcare provider and you need to be addressing your patient directly. But also just so those little tiny quirks with regard to interpreters over the years, you kind of get better at just jumping in with regard to, no, you need to say what I just said, not your version of events. You need to say exactly what I just said.
And Latasha, can you kind of add on to that a little bit with your experience and what have you seen?
Well, I agree with what Elle said. That is a thing. And then something that I have also observed, a lot of times the providers are in a hurry. And so they talk in a hurried manner and they don't give the interpreter enough time to actually interpret it and get out. So once you make a statement to the patient for the interpreter to interpret, then you need to give the interpreter a little pause time.
Yep.
So that they can process that and then speak that in the language to the patient. And so a lot of times that's not what's happening. And there's been times where I've said, can you please pause after your statements? And, perhaps they shouldn't be so long, because sometimes they're so long, they're like, I need a notepad. And I'm like, no, we need to chop it up a little bit so that the interpreter doesn't need a notepad. Just give short tidbits, because people with language barriers, they also need time to process. And if it's too big, it just kind of confuses them. Sometimes I watch their eyes and I'm like, oh boy, I've got to say something. So knowing when the interpreter service is beneficial and when it's overwhelming is also key. So I always watch for those nonverbal indicators, and I watch for body language to see how well the patient is feeling, or to make sure that they're comfortable. Because lots of times before interpreters come, we've already established a rapport, and most of the time they're pretty comfortable. But I have noticed that if it's too much, they'll look at us like, help. They don't say that, but it just kind of gives you the opportunity to say, hey, I think we need to maybe slow it down. Or can we repeat that? Or can we say it a little slower? There's a plethora of things that can be stated. So paying attention to body language and nonverbal cues is a really important job for the nurse at the bedside or even at Elle's level. It's just really important.
And really, Elle, just talk about it. When it comes to nursing, at the root of it is care. And care includes making sure not just how the person is treated in the bed or at bedside, but taking that time to really explain the information in the way that Latasha just talked about, or making sure that the person feels comfortable or that they understand what you're saying. And even if it may take you an extra 5 minutes, spending that time versus not spending it.
Right. Care transcends culture, right? But one of the things that we have to remember is that very often cultures that we interact with have historical distrust of medical providers, and we also have to take that into consideration when we're trying to provide medical care without judgment of circumstance from which people come. So there's that piece of cross-cultural healthcare, because like I said, very often the populations that we serve will come from countries or situations where there's historical distrust with vaccinations or that kind of thing, and sort of creating an environment that's open and open to questioning, excuse me, and question answering is more important than judgment laden medicine. Where you're answering questions, oh, you got to get this vaccine, or you got to do this, you got to do that, and taking into account patient circumstance. And like Latasha said, it does take longer to relay that information to patients who have language barriers, but it's especially important in those situations to relay that information, because you might be the only person that does relay that information to them. And you have to remember that that's your privilege and your opportunity to be doing that for them.
And Latasha, do you want to add to that?
Well, let's see. Sure. So when we talk about patients and the level of trust, this is something that I can relate to. I do think we're in a day and time where providers really and truly need to be mindful of the things in the past that still create barriers for some cultures to trust and actually want to go in to receive health care. I think that the fact that Elle has mentioned this and that it continues to be a concern is one of the reasons why providers really need to take that into account when they are trying to obtain the health history. I feel that, especially when a patient is Black, I think that providers from other cultures need to attempt to establish a rapport initially. I had an experience very recently with a very close friend of mine that went to emergency room here in the Twin Cities. And it was really disheartening being a medical provider, receiving the phone call. She had went into a facility and she was advocating for help for herself. And she was left in a waiting area for 8 hours. She felt that she wasn't important. When a provider finally did talk to her, he asked her 3 closed-ended questions. And I just got to say this, as a medical provider, whether you're a nurse, a doctor, a nurse practitioner, a physician's assistant, when you're trying to help a patient, you need to ask open-ended questions. When she told me the questions that were asked of her, I really felt disappointed in the system. I really felt disappointed in that provider, because every nurse, every provider knows in order to obtain an adequate health history, you have to ask open-ended questions, and you need to really take your time, and you need to build off of what your patient has told you so that you can get to the root cause and make the correct diagnosis. So long story short, this patient was so overwhelmed and so distraught and just felt a mess. She ended up leaving the facility. She ended up going back home. 2 days later, she went to another facility. This story is really sad because this patient had a miscarriage and she was hemorrhaging. Now, I believe that this is a conversation that we've had over time, but it still continues to be a thing. And I think it's really imperative that people start to tell these stories and they start to talk to leaders at the hospital, and we start making people accountable. As medical providers, we have a duty to serve and protect and assure that people are getting the best possible care. And if we continue to do things in the medical sector that don't allow people to trust us, then we're continuing to be a problem. When I say we, I don't mean me, I mean the healthcare sector. But it is what it is. I'm a part of it. So I feel responsible when things like this are happening. Even though I'm not the one doing it, I still feel it and I recognize it. And I want it to be better for all people, because all human beings deserve the best care possible in the healthcare sector.
And Elle, would you like to add anything to Latasha's?
You said it beautifully. I mean, I think that's the definition of systemic issues that contribute to racism in healthcare, right? The tremendous disparities that occur with many things. If you just pinpoint one thing, it's the healthcare disparities that occur with people of color with pain control. Just that one simple thing, and extrapolate that across cultures. Excuse me, across symptoms and across medical concerns. Preeclampsia, I could list off 100 different things that there occur healthcare disparities with people of color, cross-cultural in cross-cultural nursing and cross-cultural medical care that, you're right. I mean, Latasha said it right. We're not singularly to blame, but the system is.
And when it comes to learning how to navigate and be sensitive to the culture of the patients that you treat, when you're in school, I guess, is there any sort of standard of learning that comes with that? I know you offer it through your CNA school, Latasha, but as far as like a standard in the field, is there some level of it that's offered, or are people left to their own devices? How does that work?
So I think this is one of those things where people are kind of like left to do that on their own. That is not something that was taught in undergrad or graduate school, to my knowledge. I truly believe that is something that we need to look at. The culture is changing, diversity is happening, and we've had this issue for quite some time. So in the CNA school, I teach my students. These are my students. So I teach my students that it's imperative, right? It's not maybe, it's not a possibility, it's imperative that we are sensitive to the needs of all of our patients, whether they're Black, white, pink, or purple. Everybody is important and everybody deserves a right to be treated as a human and to get the best care, and so I spend a little bit of time just talking to them, and I'm like real matter of fact. So I have white students and I have Black students, and I don't sugarcoat it, and I let them know these are the things that are happening. There's issues with the maternal mortality. There's just the issue with Black women in pain. There's all of these myths and things that are not true. I don't know where they came from, but I had a student to say, well, is it true that Black people have less pain? Absolutely not.
Or thicker skin, right?
No, absolutely not. Right. Right. So, somewhere down the line, these things have been talked about and some people believe it. So every opportunity where I get a chance to verbalize and, make positive and actual statements that are actually the truth, I always speak up, because when the students come and sit in the seats, they're younger and impressionable, and they're just going by what they've been taught. I don't know if it was at home. I don't know if it was their peers, their last school, whatever. But it's a thing, and people are really struggling with it on many levels, because when I told her that, she said, well, for years, I've always thought that. And she wasn't like in her 20s. She was like 30. She was like, well, I've always kind of like thought that, was a thing. And I'm like, no, it's not a thing. So then her next response was, well, I'm glad that we had this talk, because I'll be mindful of that. So I don't really know how to fix it. I just know that we need to keep talking about it and making people aware of it and putting light on it. The more we talk about it, the more people hear it. And hopefully at some point we can change those narratives.
And I wanted to ask you all, from your perspective, what is something that if someone is going to a hospital and English may not be their first language, what's something or some things that they can do to try to have the best possible experience or interaction in that space? Because going to a hospital or a clinic at all can feel stressful, but I can only imagine if you're going and English may not be your first language and you need some form of care and you're not sure if what they're telling you need is what you need, or the language issues might create other barriers and challenges to providing the right care. What can people do if English is not their first language and they're trying to figure out, how do I have the best interaction possible?
So one of the things that are important, even in the Somali culture, there are a lot of Somali speaking patients, but there's also a lot of Somali people that speak English. So I would recommend that if you're of a different culture, or even if you're Black, and this is just my opinion, always bring somebody with you, especially now that COVID is over. We're now allowing people to come back into the hospitals and visit. It's nice to have a support system. It's better to go into the ER or the hospital with someone. First of all, that shows that you have support, right? And so a lot of times just having that support person, it's just a whole totally different vibe. Sometimes if people go in alone, their treatment for some reason is just a little bit different. But having somebody come with you, advocate for you, ask questions, and then if you know somebody of the medical sector, maybe bring them to, or call them ahead of time, tell them what you have going on, ask them their recommendation, and they can give you some word verbiage that you can utilize when you're talking to the medical professional. And then that lets the medical professional know that you know a little bit something about something, right? Yeah. And a lot of times when you know a little bit about something, the treatment is just a little bit different. It gets a little better, yeah. And also phone a friend. If you're my friend and you need to go to the hospital, you can always call me. I'll advocate. I'll talk to the doctor. Utilize your resources.
And Elle, I know we've talked before too. You are that person for a lot of folks that are in your immediate circle, in your family. How would you add to what Latasha is saying as well?
Oh, you just hit the once again hit the nail on the head. You just said it perfectly. I was just out. Shayla knows this. I was just out east with my dad, who was hospitalized, and it was like, you know, I guess maybe ships passing in the night with regard to communication. It was very poor, and my mom is not medically inclined whatsoever, and so you know, I ended up having to get on a plane and go out there because it was not, you know how it is. It's just you're talking to people who aren't returning your calls, or you just don't have somebody at the bedside who has the know-how to say, you need to mobilize your patient early. You need to get them up. You need to have them using the incentive spirometer. You need to do these things. And like you said, when you don't know the lingo and when you don't know what to ask for, you don't ask for it. And so you are, as a sick patient in a hospital, you are only as good as the advocates around you working for you. And that's the theory of social support, right? We know this in medicine. We've known this for decades, that the better your network of social support is, the better your outcome is going to be. And you have to cultivate a situation that is going to set you up for success. And that situation is going to be people around you all the time. And one of the things that made me think of is my Somali patients in the hospital. 9 times out of 10, it'll be a woman who comes into the hospital. She'll be in an intensive care unit, and she'll have at least two of her closest women in her family, or her closest female friends, that sit at the bedside day and night. And if she wants a sip of water, there's someone there who hands it to her and she'll take a sip of water. There's someone dabbing her forehead. There's someone there just making sure that her needs are taken care of. And some of my colleagues, unfortunately, grumble, oh, there's someone in the room all the time. It's so this, that, or the other thing. I love it. It makes my job so much easier. The patient gets better care because they're advocated for 24 hours a day, and they get culturally sensitive care because they have a person there who's like, nope, this is not how we want it done, or this is how we want it done. And she's hungry, and when is her NPO status going to be up? And as the nurse, you're like, oh, I better page because this patient's family member is going to be out and you hate to say it, but the squeaky wheel does get the most grease in healthcare.
Yes, and really, that's going to be a conversation that we're having again, just more specifically coming up about advocating for yourself and your family. But it really crosses into this space too, probably even more important here because you're dealing with getting care, and if English may not be your first language, you have to make sure that the care that you're receiving is in alignment with the care that you need, and if you are or are not getting what you need, knowing that you need something different and to be able to ask for that, and having somebody there that can speak for you, it can make all the difference in life or death, right, Latasha?
This is true. Yes. Did you want me to elaborate on that?
Yeah, sure.
So I think sometimes when patients are sick, particularly adult patients, and there's no one there to advocate for them or to really tell what kind of symptoms that they've had, if they're not feeling up to par, I think sometimes things can get missed. So I just truly believe that there's no other way to go into the hospital besides to have somebody with you. And so with COVID going on, that was very challenging in a lot of capacities. While we were trying to protect the community and the greater good, we also we created some barriers, and it was very noticeable at the bedside. So just having that point of contact person, family advocate is really beneficial. And I don't really know if things are going to keep going on the positive for COVID, but I hope so, because it was kind of scary for a lot of patients when they weren't able to have, especially for like Somali patients, they like to have like, I don't know if they're called elders, but like we were only allowing like the mother and the father, and there was a lot of dialogue and conversations with people being frustrated. We had, because at children, sometimes our kids are there for a while. You know, we kind of had patients that would cry. They were so overwhelmed. They needed their mom to come, but grandparents weren't allowed. And it just really becomes taxing, you know, when there's not enough support at the bedside. And depending on the diagnoses of the patients, you almost need people to be able to switch in and switch out, because some of that information is emotionally taxing at times. Would you agree, Elle?
Yeah, that's exactly right, especially with your patient population too. I mean, you're experiencing some of the worst days of your life as a parent, right? And like you said, with the pandemic, we had one of the most memorable situations. We had during the kind of the really the worst of the worst in April, May. We had a Somali man who we had tried everything with regard to managing his COVID ARDS, and nothing was working. And we had to make the difficult determination that we had to withdraw cares on him, take him off the ventilator. And the cultural practices surrounding death with regard to Somali and in conjunction with that, the Muslim faith are very specific, and there's a very long list of things that are expected to be done, and I'm pretty familiar with them over the years. And the family, we had called the family, we said, okay, we're going to withdraw cares, and we can wheel in the video chat so that you can say goodbye to your father. And I'll never forget the phone conversation that I had with the daughter. She said, I can't say goodbye to my dad via video chat. She said, that's not how you say goodbye to somebody. And it was such a human moment, and sort of reminded me that we were all going through it right then. And when he took his final breaths in the last moments of his life, my coworker and I were I was holding his left hand and she was holding his right hand. And he took his final breath. And at that very moment, this just cataclysmic wind kicked up outside. It was totally, we were like, whoa, that was totally, it was a really spiritual moment for me. And so, this doesn't, I suppose it doesn't totally relate to cross-cultural healthcare, but I think it's also an extension of humanity. Everybody went through it the last year and a half. And I think not being able to be there for your family member, especially with the language barrier, like you said, and with with sort of cultural idiosyncrasies, is so much worse, I think.
Yes.
And Elle, you did a lot of work with resuscitation, and I know at the height of this, at points, you said the hospital was, there were no more beds to place, like you were at full capacity. And talking about the challenges of not just the language barrier, which language in itself, not knowing it, can feel isolating, but then to also have an illness that further isolates people from their loved ones in the way that you just described. You probably saw that over and over again. How do you navigate that? I know as a human and as a person who cares and has compassion for others, does the weight of that carry on with you, or how did you navigate that over time?
I think trying to make room for those cultural practices becomes even more of an imperative in these situations. When you're already isolated, like you said, when you're already out of touch with your family and you can't have physical contact and you can't have those familiar cultural foods and those familiar cultural smells and that the multi-generational family that surrounds you and those kinds of things. I think it's especially important to incorporate the things that you can into your practice, making room for those practices. I remember, and I'm not sure if it was my hospital or one of the other local hospitals. I remember hearing a story about a Native American man that was that they were also withdrawing cares on, that they made a space for the family to be outside of the room. They couldn't come inside, but they were able to do a sage burning outside of the window as part of their cultural practice. And getting creative in those situations is really important, but also acknowledging the fact that it's not the same, and being able to grieve for the loss of that is important also.
Right. And Latasha, would you like to add as well?
Not really sure that I want to offer a lot more there. I kind of feel like I've already kind of touched on it.
Okay. As far as the last year with COVID and your experience, were you at the Children's Hospital for most of that?
I was.
Okay.
I was.
Okay.
And I also, sorry.
Oh, yeah, go ahead. You're fine.
So I was working as a nurse at Children's, but I had the opportunity through a local organization that I'm a part of. It's called Black Nurses Rock. I was able to do COVID testing from earlier on once they started that. And then I was able to do a COVID vaccine. So I was able to talk with lots of adults, lots of family members. And so I learned a lot about how the community, whether it was Black, white, Somali, I kind of learned a lot about how people's thought processes were in relation to COVID. Some of them decided to be vaccinated, and then there's still a plethora of others that are still dealing with the distrust issues. And so they haven't been vaccinated. There's a fear factor there. And that just kind of goes into alignment with what we were already talking about in the healthcare sector. So I don't really know what you were going to ask me, Shayla, but I thought it was just really important for me to say that. I do pediatrics full time, but I do adults PRN. So adults are my favorite. It's just I wanted to do something different most recently, but I have a love for adult patients. I love it, actually.
Well, it's important to do what you love, right?
Mm-hmm.
So when it comes to vaccinations, and right now Minnesota, of course, is one of the states saying, please get vaccinated, please get vaccinated. What are the different challenges to encouraging people of different cultures to go get vaccinated and maybe understanding the importance of it? What are some of the things that you're navigating in that process, both Latasha and Elle, as statewide, nationwide? People are saying, get the shot, get the shot, get the shot. But if you have some distrust of the medical system and this is part of that system, you're wondering, why are they pushing me so hard to do this? Why do I need to do this? And you're probably, not sure if it's the right thing for you in some cases.
Do you want to start off, Latasha?
You want to start with Latasha? Okay.
You can go first, Elle, if you want to.
Oh, yeah, sure. I think that the historical doubt that has been seeded in particular the Somali community in Minneapolis, the doubt that's been seeded in that community, especially with regard to the MMR vaccine, when the Andrew Wakefield study that came out that was debunked, that history is still fresh, I think, for a lot of people. And I still see people in my patients in my clinic that are that link the MMR vaccine with autism, which is not accurate, right? But I do have to say that with the COVID vaccine, I think that the sharp decrease that we saw in virus spread and with relation to the vaccine, I think people saw the obvious writing on the wall and got vaccinated. One of the other things that I think was a real big persuader was that I think that airlines and international travel is going to start becoming restricted to people who are not vaccinated. And so that's a big selling point for me, because a lot of my patient population wants to travel back to, Africa and other places. And, I have to say, you might not be able to go because if you don't have your vaccines up to date. And then, reassuring them that it is safe is a really, really important thing. Another good selling point is impotence, right? One of the side effects of getting the COVID vaccination is impotence, and so that's a big selling point for some of the men that I take care of. But yeah, I think respecting the doubt, answering the questions that need to be answered, is really the best way to get more people immunized.
And Latasha?
Well, let me see what I can add to that, Elle. I think just really acknowledging those historical events that have occurred, which particularly in the African American community, I'm just going to go there for a little bit. I think just really recognizing the historical things that have happened and the thought processes of the community and the population after those things. Whenever they first offered the COVID vaccine at my job, I knew that I was going to get it because I'm a medical provider, and I wanted to protect myself and perhaps protect my family. I wasn't 100% sure about all the ingredients and all the things, but I wanted to set an example, because I know that the health disparities in the African American community vary from other populations, and I just wanted to set an example and show them that I was going to take the vaccine and I wasn't going to lose my arm. Like, I had family members and friends that said, if you take the vaccine, are you going to lose your arm? Is your leg going to be shorter? Like, there was all of this negative publicity surrounding the vaccines, and so people were unsure. And that uncertainty spoke volumes to me. It's like a lot of people aren't trying not to get the vaccine. They just don't understand all of the particulars surrounding it. And based on how we've been treated in the past, they're going by that. And a lot of times people don't forget, especially when it's in the medical sector. When you talk about the Tuskegee, they did some really harsh things to Black people, and people, it's hard to just kind of move past that. So what I like to do whenever I'm having dialogue or communicating with someone about the vaccine, I tell them which one I got, how it worked for me, how I feel it benefited me. I never got COVID, by the way, being at the bedside the entire time, never got COVID. But I feel that sometimes if you sprinkle the positives and you kind of share your story, sometimes it helps a little bit. But then also I added the component but I didn't just do it for me. I did it for my patients. I did it for my mother. I did it for my father. I did it for my asthmatic daughter. Like, I personalized it and I made them see the relevance of it. And then I told them, take your time thinking about it, give it some thought, just really think about it, talk with your family, and then you make the decision. Even if you said no today and you decide 2 weeks from now you want it, it's still available. So just really being kind, unhurried, a good listener are things that we need to do, because some people are scared. They're scared to get checked out for high blood pressure and diabetes. So we know they're scared about the vaccine. So we just have to be patient, gentle, understanding, sympathetic, empathetic, and just really offer support on all levels and a lot of education. As medical providers, education is imperative. The more we know, the better we are.
Absolutely. And we have about 10 minutes before we wrap up. If anyone would like to leave a comment or ask a question, feel free to do so at this time. If you would like to pop up and ask a question, we just dropped the link in the comment section. So if you'd like to join for a moment and ask Latasha or Elle a question, you could do so at this time. If not, I would like to ask Latasha and Elle, we'll start with you, Latasha, if you'd like to leave any concluding thoughts, or if people leave with nothing else today, what do you hope that they take away from this conversation?
Well, there's a couple things that I hope people take away from this conversation. The first thing is, whenever you go to the hospital, especially for people that speak a different language, always advocate for yourself. If there's not an interpreter at bedside of some capacity, whether it's a human, it can be a telephone interpreter, or it can be a Marty interpreter, speak up, advocate for yourself. I also want to encourage people whenever they go to the hospital sector to take someone with them. There's just better healthcare outcomes when there's a support system there, right? Mm-hmm. So whether it's your mother, your father, your sister, your neighbor, anybody that loves and cares for you and that can advocate and get those symptoms across to the provider so that the correct diagnosis is made. And then also, another thing that I would want to add is if we could make sure whenever we're at the emergency room or the doctor's office that we tell the doctor or the nurse everything that's going on without leaving out anything. So, if you've had the symptoms for 7 days, tell the doctor. If you had them and they were excruciating, describe the kind of pain. Give them a full summary of the events leading up to the event that you are now and what happened prior, because that helps them create a better diagnosis so that they can better care for you. So I think those are the most important things. And then to show up. When you're sick, go see somebody. If you have a headache, go see somebody. If somebody told you at a pop-up event in the community your blood pressure is high, go see your provider. There's things that we can do to help, right? And I mean, a lot of people don't like medicine. It doesn't always have to be medicine. We could ask you to maybe try to lose a little bit of weight, do some exercise, come back in 4 to 6 weeks, we'll reevaluate. The first time you go, that doesn't mean they're going to put you on medicine. Sometimes lifestyle choices and modifications can be beneficial. But if you never come see us, we don't know that you have a problem. And we can help you better in the initial stages and phases.
All important information for people, because sometimes it is scary when you need to go to a doctor's office, and sometimes people are scared to go because they don't want to find out what that problem they've been having actually is. And so they sit on things for longer than they should, and then something that could have been a small fix becomes a big one. And so that's certainly important information. Elle, I was just asking if there was anything you wanted to leave everyone listening with today. What would you want them to know? It can be anything specific to nursing across cultures, or just anything you want them to know to make their next appointment a great one or a better one than their last one.
Yeah, I mean, my message to healthcare providers, I think it's important to consider the station that your patients come from. Like Latasha said, it's sometimes patients don't go in because of distrust, and sometimes people just have transportation issues. There's a tremendous amount of barriers to medical care, in particular with our multicultural patients. We have to remember that we need to personalize medical care. It can't be one size fits all. If I have an iron deficiency anemia patient come see me in clinic, and prescribing iron is the only thing that they want, and they're not going to come back to get their iron levels checked, they just know that their hemoglobin's low, then we have to be flexible in some of those situations. And then to patients, I mean, like Latasha said, having an advocate there for you, and asking for an interpreter, also really, making sure that you ask for an interpreter, and sometimes it's a little more challenging to get through a visit with an interpreter, but demanding it is really important. You got to demand an interpreter. Get advocacy.
It makes all the difference. Well, thank you all so much for joining me today. I appreciate your time. And of course, as we continue to navigate the latest turns in the pandemic and the Delta variant and what that's going to mean as we push forward, not only as Minnesota, but across the country. I know there are a lot of questions that people are going to probably continue to have. What does all this mean? What does this mean for me? What does it mean going back to school, even with kids getting ready to navigate that turn from summer back to the classroom? So, any space that we can create to make it a little bit easier for people to ask questions or get questions answered or have some of the conversations that I know you all have mentioned today, just the importance of keeping the dialogue there. Creating space to do that is valuable, and I appreciate your time today after a long week, I know for both of you, to just give a little bit of your time to be a part of a conversation like this one. If you tuned in a little bit late, as soon as we wrap up this conversation, you'll be able to watch the whole thing back at the same link that you clicked to get here. And it'll be available online on YouTube at my Shayla's Creative Side page. And thank you all so much for joining me. And I will see you next time. Take care, everyone.
Thanks, Shayla. Thanks, Latasha.
Thank you. Thank you.
Bye.
Nice to meet you.